Well, you've just completed your vasectomy. We're going to keep you here for the next 10 minutes or so just to make sure you're feeling okay before you head off. In this short video, I'm going to go over your post-operative instructions. Written instructions will be sent to your email and to your phone in the next 30 minutes or so. These instructions have my mobile phone number, so feel free to call me at any time, day, night or weekend, if you have any issues or concerns. Things to look out for are a large swelling on one side of the scrotum, which could indicate a scrotal haematoma, or severe pain that's not responding to Panadol or Nurofen. The local anaesthetic we use during your procedure will start to wear off in the next hour or so, and you may start to notice some discomfort. If it bothers you, please take simple painkillers such as Panadol or Nurofen. You can take both if you like, but if you're going to choose one, I'd suggest Nurofen as it has anti-inflammatory properties which are particularly effective for post-operative pain. You may also apply ice to the scrotum over the next few days. This may help with the bruising and swelling. 10 to 15 minutes every hour or so is usually sufficient, and make sure you put the ice over your underwear and not directly against the skin. You should wear good supportive underwear like jocks for the next few days, as gravity and movement are not good for the traumatised tissue inside your scrotum. Avoid boxer shorts or going commando. The wound has been closed with either steri strips or stitches and covered with a dressing. This top dressing can be removed tomorrow and left off. Steri strips will usually fall off in a few days, but if they haven't come off in a week, then gently peel them off. If for some reason your steri strips and top dressing fall off, don't worry. Simply place a band-aid over the wound for a couple of days, and this is all you need to do. The stitch is absorbable and can be left in place. It will disappear in about 4 weeks. You can have the stitch removed if you prefer, but if you do so, do it no later than 14 days after your procedure. Remember to really take it easy for the next week, but particularly the first 2 days. No strenuous exercise, heavy lifting or sex during this first week. I don't advise a specific weight limit with regard to lifting, but just suggest using common sense and avoid straining. Day-to-day tasks like lifting a bag of groceries is fine, and if you need to pick up a small child, do so with caution. Bed rest is not necessary, and you can walk to the shops, for example, but long walks should be avoided. If you're feeling good after 7 days, you can resume these activities, but definitely not before. Some of the complications we see are because guys go too hard after 2 days because they feel great. If you're still a little sore at 7 days, then just give yourself a little bit more time. Any time up to 14 days is still considered a normal recovery. Martial arts, contact sports and bike riding need to be avoided for 3 weeks. Motorbike riding really depends on the bike you're riding. If you're sitting up in a comfortable position on a large road bike, then you can probably get back on the bike after a week. But if you're straddling the bike and your scrotum is rubbing against the seat, then you need to also wait 3 weeks. I'm often asked by guys whether they can drink alcohol after their vasectomy. A couple of beers is fine, but just don't overdo it. Today we will give you a pathology specimen jar for your sperm test, and your pathology request form will be emailed to you in the next couple of days. This sperm test should be completed in 3 months and after you have completed at least 20 ejaculations. We'll send you a text message to remind you to do the sample, and on the text message there'll be a link to a video which will explain the process and where to drop your sample. Remember, don't bring the sample back to this practice. It must go directly to a lab where they can look at it straight away. I'm often asked by guys if they can do their sample a bit sooner if they have done their 20 ejaculations. The answer is yes, but no sooner than 8 weeks. The flip side of this is if you get to 3 months and you haven't done 20 ejaculations, you must wait until you do your sample. And remember, you must continue to use contraception until we've given you the all clear. Before you leave, please see reception to pay your account if this wasn't collected on arrival. Depending on your location, you will either have your Medicare rebate processed at the practice, or your invoice will be emailed to you in the next 24 hours and you will need to submit to Medicare for your rebate. Well, thanks for watching. I'll join you shortly to go over any final questions you have.